draws on every single thing that you've learned in nursing school, every skill, every theory, every family you've worked with, all of your experience.
I practice at the systems and population level in my role as Director of Family Services because we look at the health needs of the whole population and say what is it that we most either need to assist with or to help bring the community together to help solve in terms of gaps in services or needs that are not met. I have the opportunity to work with many different agencies, hospitals, healthcare organizations, our own staff, and sort of facilitate development of health care and public health support.
My day is about building community collaborations so communities can care for themselves and not have to rely on somebody who thinks they understand what their community needs.
There's a small percentage of time that I'm out in the public health setting or in the community providing immunizations or educating providers about vaccine.
Probably my biggest role is really in affecting nursing practice and clinical practice in general within the home care agency.
We evaluate and assess and see the workers and help to provide a safe and healthy work environment.
We case manage mothers who are pregnant, who are hepatitis B surface antigen positive.
I do regular education at the orientation level, do some classes as new nurses are hired to the agency, and on an ongoing basis. I work in concert with process improvement and do some of that work as well.
I work with students with chronic illnesses. There are about 45 students who require nursing services. I work with the homebound teacher because we often have children who need homebound instruction. And so I facilitate that as well. Last year I did start a wellness program. I worked with the president of the senior class, some of the administration, the lunchroom management, physical ed department. And we tried to get everyone on board.
The services that we provide are on the clinical side, the return to work programs, working with managers, with employees to be an advocate for them to integrate them back into the workplace. I'm working with a team to help reduce injuries in the workplace. We need to have programs to reduce the stress on the musculoskeletal system.
I make a difference every single day in the health of the people who live in our state.
The best part of my job is the autonomy. I get to be creative in meeting my objectives for the program.
The best part for me is that I do stay really engaged working with patients because to me as a clinical nurse specialist, some CNSs may stay more focused on some of the administrative and all the background stuff, the educational stuff that I'm certainly doing, but I think to be really real, you have to be out there in the field.
I know a lot of people say they don't like high school students, but I do. And you know what? It's a trust level. I like to make sure that the parents receive all of their services. And that's a good part of my job. I really enjoy that.
The best part of my job is
Interacting with the people.
sitting down at the table with a bunch of folks and saying, here's the issue, what can we do? But that tending a new idea, finding new ways to make it happen, to me is very creative.
As an occupational health manager, we partner with all different areas and professions.
I tell people, if you need to touch a patient every day, then public health is probably not for you. And if the idea of making a difference for an entire group of people, girls between the ages of 15 and 24 who are pregnant, if you think it would be really cool to take care of an entire population and make a difference in all of their lives, then public health is for you.
The underlying issue is health reform, and we need creative, articulate, thoughtful, analytic nurses who understand the big picture to really help create the elements that make prevention possible, that make the true health system be more than a treatment system.
It's a great opportunity to get experience in entrepreneurship. If you want to take your practice solo and you want to do a community project, you'd like to see the number of obesity cases decline, and you want to be a part of that, then this would be a great opportunity.
The kind of patients that we're seeing in the community and home health, they're complex. It really demands that you put in place best practices that are evidence-based, and it really takes the clinical nurse specialist to really bring those practices alive to the average nurse out there who's just trying to see the patients and get everything done.
There are many ways that occupational health nurses in management can provide programs that can affect the employer's bottom line to help them to save money, to help to increase the productivity of the worker, but also to help the worker to be successful at work, because work is a part of life.
If they like working with healthy individuals, if they like working with students and to teach them how to become independent or how to work through their chronic illnesses.
We're really making a difference when our numbers of case finding and babies are being vaccinated on time and hospitals are complying and the OBGYNs are doing what they need to do.
Just recently, I have started an STD community coalition, bringing together legislators, religious leaders, school nurses, and public health officials, and just a wide swath of people to begin to understand the common ground of what brings us all together and why do we care that kids don't get sexually transmitted diseases.
One way that a nurse can determine whether or not they made a difference is that if everybody in their school has health insurance and a decrease in the adolescent pregnancy rate, at least by 10%.
We did a whole day-long planning session and came up with 5 prototype projects that are being implemented.
We have actually reduced, for example, our urinary tract infection rate among patients with catheters. I'm able to demonstrate that we've improved our clinical practices.
I know that those prototype projects will make a difference, and they're all community driven. They weren't driven by the state health department saying, you should go out and do this. They're driven by us convening people and helping them understand the width and breadth of the problem.
I'm very clear in terms of identifying patient problems, developing the plan of care, appropriate interventions, and am I achieving those outcomes? Not only the smaller clinical outcomes, the interim ones, but on a broader scale, the outcomes that contribute to defining the outcomes of our agency from a publicly reported outcome basis.
We implement a part of a drill for the hospital vaccination response team, practicing mass vaccinations for the community through the HDVRT, Hospital Vaccination Response Team. In one day, we vaccinated close to 3,500 people. This is our effort to practice and to learn and to be ready for mass vaccination, mass prophylaxis, should it need to happen in the future.
One of our priorities in our community is the disparity in health outcomes for particularly African Americans. 3 of our providers are now in the process of implementing centering pregnancy. So it's just an example of saying what's out there evidence-based, what are our needs, and then how do we work together?
I don't think there's a place in healthcare right now where you can just kind of do what you want without being able to demonstrate that, you've made an impact.
I think of public health nursing as the tapestry. And we want our community to see that picture of how they can become healthy and grow healthier.
It draws on every single thing that you've learned in nursing school, every skill, every theory, every family you've worked with, all of your experience.